Thank you, Dylan. I hope I'm clear enough.
Yes, you are.
Can you hear me very well?
Yes, thank you.
Thank you. I just want to, first of all, I want to endorse this report. I think it's very clear. It's helpful to educate both leaders in our countries, professionals in various spheres who deal with patients who smoke at different times of their lives. But from what Derek and what Josi said, there are a number of implicit issues that we need to work on. The first one is to step up advocacy. It's very clear from what Josi said that a number of doctors do not have enough knowledge about what nicotine is, what its effect on the brain is, does it cause cancer or not? Secondly, they don't know what the smoke in combustible tobacco contains, the carcinogens that we refer to. There's need to promote more and more webinars, discussion groups, bring about the table experts who can talk about these issues. I think that's very, very important. So advocacy and education are key. The next point, which I think is very important, based on deliberations in tobacco harm reduction meetings in Athens, it's very clear that we need to also work on a systematic program of making people understand harm reduction. I think Jose is tired. He is very tired of explaining this, but I think we shouldn't be tired of explaining and re-explaining principles of harm reduction. Currently, I'm at a global policy conference in Cape Town, and interestingly, there's been comparisons between the Framework Convention on Tobacco Control and the proposed Framework Convention on Alcohol Control. The Philippines, for instance, presented a study showing increasing in taxations. What that study basically told us is that the taxes went higher, the government received more revenue. However, people are continuing to smoke and drink without appropriate information. So more education, giving people enough information to make informed, decisions and make, choices that they like. It's very, very important so that they cannot blame people. But what is also becoming clear is that those people with more knowledge about the dangers of combustible cigarettes and the safety and improvement in their health because of the alternatives such as, who testify about improvement in their health have either quit smoking or reduced smoking, and are now educating people in the field of smoking, discouraging them from using combustible cigarettes. I think the last point I really want to make is that I know some people become impatient with politicians, but they govern the countries, they make the laws and so on. We need to be doing more research and presenting it to them. In this conference on the alcohol policy development, it's very clear, same as in smoking areas, that politicians make decisions based on very little information. So we should encourage research at educational institutions such as universities, within communities, private practitioners, and others, so that that research can increase our knowledge. We don't want 10 years later to be told there is not enough information about vaping, there's not enough information about snus, there's not enough information about heat not burn, and so on. I think what Sweden has done is very important. That information is there, the research has been done. The issue is really implementation and spreading in Europe. And Jose has made this point also at various meetings. So to summarize my input, we need to step up education. We need to have a strategy of promoting research at our educational institutions. We need to bring together professionals in various forums and make sure that we teach them about smoking generally, what is in combustible cigarettes, the smoke, what is in the vaping, what is in heat not burn, alternatives. I think that form of approach will also help give people information that will be publicized through the media, and of course, reports such as the one that we are endorsing today. Thank you very much.